Hydrochlorothiazide is a thiazide diuretic used to treat edema associated with a number of conditions, and hypertension. In this video, let's find found. What is hydrochlorothiazide? What is hydrochlorothiazide used for? Contraindication. What are the side effects of taking hydrochlorothiazide? How does hydrochlorothiazide work? How to use hydrochlorothiazide? What is hydrochlorothiazide? Hydrochlorothiazide, sold under the brand name Hydrodiuril among others, is a diuretic medication used to treat hypertension and swelling due to fluid buildup. Two companies, Merck & Company and Ciba Specialty Chemicals, state they discovered the medication which became commercially available in 1959. It is on the World Health Organization's list of essential medicines. It is available as a generic drug and is relatively affordable. In 2020, it was the 11th most commonly prescribed medication in the United States, with more than 41 million prescriptions. What is hydrochlorothiazide used for? Hydrochlorothiazide is indicated alone or in combination for the management of edema associated with congestive heart failure, hepatic cirrhosis, nephrotic syndrome, acute glomerulonephritis, chronic renal failure, and corticosteroid and estrogen therapy. Hydrochlorothiazide is also indicated alone or in combination for the management of hypertension. Contraindication. Hydrochlorothiazide is contraindicated in anuria. It is also contraindicated in patients who have previously demonstrated hypersensitivity to hydrochlorothiazide or other sulfonamide-derived drugs, severe renal and hepatic failure, Addison's disease, and hypercalcemia. Side effects. Hypokalemia, or low blood levels of potassium, are an occasional side effect. It can be usually prevented by potassium supplements or by combining hydrochlorothiazide with a potassium-sparing diuretic. Other disturbances in the levels of serum electrolytes, including hypomagnesemia, low magnesium, hyponatremia, low sodium, and hypercalcemia, high calcium. Hyperuricemia, high levels of uric acid in the blood. All thiazide diuretics, including hydrochlorothiazide, can inhibit excretion of uric acid by the kidneys, thereby increasing serum concentrations of uric acid. This may increase the incidence of gout in doses of greater than or equal to 25 mg per day and in more susceptible patients, such as male gender, of less than 60 years old. Hyperglycemia, high blood sugar. Hyperlipidemia, high cholesterol and triglycerides. Headache. Nausea/vomiting. Photosensitivity. Weight gain. Pancreatitis. Pharmacodynamic. Hydrochlorothiazide prevents the reabsorption of sodium and water from the distal convoluted tubule, allowing for the increased elimination of water in the urine. Hydrochlorothiazide has a wide therapeutic window as dosing is individualized and can range from 25 to 100 mg. Hydrochlorothiazide should be used with caution in patients with reduced kidney or liver function. Mechanism of action. Hydrochlorothiazide is transported from the circulation into epithelial cells of the distal convoluted tubule by the organic anion transporters OAT1, OAT3, and OAT4. From these cells, hydrochlorothiazide is transported to the lumen of the tubule. Anti-drug resistance associated with protein 4, MRP4. Normally, sodium is reabsorbed into epithelial cells of the distal convoluted tubule and pumped into the basolateral interstitium by a sodium-potassium ADPase, creating a concentration gradient between the epithelial cell and the distal convoluted tubule that promotes the reabsorption of water. Hydrochlorothiazide acts on the proximal region of the distal convoluted tubule, inhibiting reabsorption by the sodium chloride symporter, also known as solute carrier family 12-member 3, SLC12A3. Inhibition of SLC12A3 reduces the magnitude of the concentration gradient between the epithelial cell and distal convoluted tubule, reducing the reabsorption of water. Half-life. The plasma half-life of hydrochlorothiazide is 5.6-14.8 H. Dose. Hypertension. 12.5 to 50 mg PO once daily. Edema. 25 to 100 mg PO once daily or twice daily, not to exceed 200 mg per day. Hypertension and heart failure, off-label. 25 mg PO q-day or twice daily, not to exceed 200 mg per day. Mild fluid retention and heart failure, off-label. 25 mg PO q-day or twice daily, not to exceed 200 mg per day. Safety advice. US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about hydrochlorothiazide we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.